All right, welcome to Tuesday Live. Today's topic is 5 trends you need to know about back pain and treatment, because things are changing and they're not getting better. They're probably getting worse. Matter of fact, it's not probably, I know they're getting worse because they are getting worse. All right, 80% of everybody watching this video right now will have back pain in their lifetime. 50% of all workers this year, so if you're a worker, 50% of you this year will have back pain just this year. Within the first year, 25 to 40% chance of your back pain coming back. 80% chance of your back pain coming back in your lifetime. So if you've had it once, there's an 80% chance of the back pain coming back again. Now here's the problem. Back pain is getting worse. There was a study done by the University of North Carolina, and what they found between the year 1992 and the year 2006, back pain was getting worse. Back pain, chronic back pain, was getting worse. It had gone from 3.9% to 10.2%, so it's a 2.6 time increase, so it's more than doubled in a 14-year period. Now, why is this a problem? Chronic back pain is the back pain that's not going away, and this is a new trend in our culture. And it's not just about the back pain, it's the choice of treatments, because chronic back pain patients tend to get treatment, where acute back pain, which means I never had back pain before, I just got back pain today, they tend to not get as many treatments. But the chronic back pain tends to get more treatments, and the treatments sometimes can be devastating. But chronic back pain conditions typically are herniated disc, bulging disc, degenerated disc, stenosis, arthritis, sciatica, spondylolisthesis, failed back surgery, which is a very high percentage, and ruptured disc. So these are complicated back problems. The longer you have a back problem, the more complicated it becomes, because over time, slowly what happens is the disc between the vertebrae wear out, and as the discs wear out, the problems become more complicated. And the choices of treatment are becoming more devastating. It's not uncommon that injections are administered, but here's the fusion's a big problem, and a bigger problem we have in our culture right now is the use of opioids. 50 to 60% of all patients with chronic back pain will be administered opioids sometime in their back pain episode. And the use of opioids is leading to overdose. There's a very, very, very high number of overdoses every year as a result. So 20 to 29% of all opioid users, if you're prescribed opioids for your back pain, misuse the opioids. 8 to 12% of those develop an addiction. The numbers are, for every day that you take the opioid, you increase the likelihood of the addiction by 1%. So if you take it for 10 days, your addiction rate possibility is 10%. If you take it for 30 days, there's a 30% chance of being addicted to opioids. Highly, highly, highly addictive. And they can be devastating. 30,000 people die every year, 1 every 15 minutes, as a result of opioids. 20,000 of those patients have a prescription for the opioids. That's the same people that misuse it. They take too much and it leads to an overdose. 10,000 people die every year from the heroin, but 80% of those people started with the opioid as a prescription and graduated, unfortunately, to heroin. Because sometimes what happens is you can't get your prescription refilled, but you have a highly addicted state in your body where the biochemistry is highly addicted, and people end up going to heroin and they die from the heroin. So this is not all about doom and gloom, but this is about trends happening right now for back pain. And sometimes we think back pain is kind of benign, but it can be more severe. Common opioids: hydrocodone, oxycodone, morphine, codeine, fentanyl. This one tends to be the one that causes the most overdose deaths. Recently, unfortunately, Prince died. He was taking fentanyl. And Tom Petty also died from taking fentanyl prescribed for pain. Tramadol, heroin, and methadone. Those are all opioids. Common for treatment of back. Okay, we don't use drugs. We don't use any surgery in our clinics. We have a process where we can eliminate back pain without the drugs or surgery. But chronic back pain patients tend to seek more care because they're living in a state that is hard to live in. When you have chronic pain, a lot of things become problems. So they seek more care, they use more healthcare services, and it drives up costs. The average patient that has chronic back pain that's not going away costs insurance companies $2,500 more every year. So it tends to be very, very expensive, to the point where it's more expensive than some other major conditions. So the total cost of back pain is in some cases over $200 billion. Now that's the cost of lost time from work, but it's also cost of treatment. The average treatment for back pain in our culture in the United States is $100 billion. It's $100 billion. There's 149 million lost work days due to back pain. It's the most common reason for not going to work. The cost is increasing. As our percentage of chronic back pain goes up, the cost of the back pain is increasing as well. In 1992, 15% of all disability claims were for back pain. In 2006, there was a 28.2% of all disability claims were for back pain. As back pain gets worse, because it's getting worse, people have it for longer and it's more severe, the disability from that goes up. Average disability check is $1,200 a month. Not a lot of money, but there's 7.7 million people right now that can't work because of a disability to their back. So back pain's getting worse. And as our technology gets better, unfortunately, it's leading to more costs. Average over a year cost to treat cancer, which is obviously life-threatening for anybody that has it, is $86.6 billion. The average cost to treat back pain is $100 billion. We talked about that. Okay, back pain comes from here. $100 billion, and it's getting worse. It's the disc. If you have a disc problem, you have chronic back pain. And it's costing lots of money, and people are getting worse. It's not like cancer. Okay? It is like cancer from the point of view that if you get addicted to opioids, there's a good chance you're going to die. But it's this part of the spine. It's $100 billion. So, what does that mean? The current system for treating back pain is broken. They're not eliminating the cause, and they're over-medicating the problem, and people are dying. But things are changing. The science has changed, and because the science has changed, you need to know what the science is. You know, first of all, you don't have to live in back pain. There's a way to get rid of it. We have a way to get rid of it. You certainly don't need the surgery. 95% of all surgeries are not necessary. 95%. We've proven it. So because the science has changed, my goal is to do an educational piece every week about the science, because the more that you know about your condition, the more likely you are to eliminate it. That is my goal. So we're going to do one piece every week where we talk about the science, because there is science. Our goal is to let you understand what that science is. Why do we do this? We do it because people don't know the science, and people that should know the science, other doctors, You go see a doctor and he gives you a bunch of exercises and it makes your pain worse. The next solution very often is surgery. Okay, that's not the right science. We know the science. So I'm going to educate you. That's my process. That's my goal. Why? Because I had a back problem. I had a back problem for years, for 10 years. And for 25 years, I've been treating back pain. Tens of thousands of patients have gone through our program, and we treat the worst patients because our patients all have chronic back pain. Okay, this is my MRI. Severely degenerated disc, herniated disc, stenosis, bilateral sciatica. Okay, I've had it. I've had the problem. But in our clinics, we've done studies and we've advanced the science. We had a study published in 2016, beginning phase. We have another study coming out now with 1,200 patients that all needed surgery, and they got better. So we have a process. But what you need to do is you need to understand the science. The more you know about your back pain, the more likely you are to eliminate it. And the better you understand the science, the easier it is for you to make good decisions. Better decisions come from understanding the problem. That is our goal. This is a sort of a comparison of our therapy, the amount of improvement we get with our therapy compared to all other therapies. There is a science. We're going to talk about the science. So I'm going to do these live events. We do them often, but I'm going to do one science event a week. We talk about the science. If you like what you hear, like our Facebook page. You'll be alerted to when we go live. We're also on YouTube, and this is Twitter, and this is
Instagram.
Instagram. All right, so that's it. Our goal is to give you information. The science has changed. If you don't understand the science, you're more likely to have back pain that doesn't go away, because that is the trend. It's a cultural trend. So that's it for today. Tomorrow we have a live event where we're showing you what foods you need to eat, because certain foods are good for your back. Certain foods are bad for your back. So that's it. We're done. Have a good night and be careful and stay out of trouble. And I'm out.